I can go. Patient-centered medical network in Sweden, which would be framtidsplanen för nätverkssjukvården i Stockholm och Sverige. What is the vision for that?
Well, the vision is exactly what it sounds like, that the patient should be in the center and be surrounded by hospitals and specialization centers and of different kinds, and also be helped around in the system by different digital services. And this is also necessary to reduce cost for the system, because it's only the sickest patients that should have the mostly specialized care or the most expensive infrastructure, and therefore you need all these digital services for the simpler cases. And
would that be a more effective way of serving the patient than what we see today?
Yes, I think it's both a possibility to have all these digital services. It will give better health, but also it's necessary to cut costs.
You are presenting a vision here, and how far away do you see this vision?
Well, we are implementing it right now. We have a political consensus, I would say, in the county council about the principles, and we have had years of preparation, and now we are putting it into place.
What would be unique about that, Anders?
Well, it's really a way of organizing healthcare around knowledge instead of organizational units. That's quite a lot what it is about. And actually, maybe it's the first time where actually the patient could be sort of at the center point of healthcare. Today, it's more the organization or the reimbursement system or something else that are in sort of the center of it. And of course, what we are lacking is how to push information around in the system to be able to get it to work. And we're not there yet. It will take many years more to come. We also need to alter reimbursement system. It's done for the old type of healthcare, and it's also sometimes a hindrance for innovation to be introduced and used, both medical innovation and ICT innovation. And also, what's the hardest thing, I don't think, is not really the shall we call it, the hard stuff innovation. It's rather to try to reform all the people that are working within the system to guide, look at patients as a resource and not as a sort of plaything for their own sake.
For their own research.
Yeah. Well, we had mentioned before about new hospitals being built in different kinds of the world. I mean, and we're building the NKS now, the new Karolinska, and the fewer beds in NKS than in previous, and I mean, is it the reason for that? I've heard.
Johan Permert, maybe you can answer that question. So NKS, Nya Karolinska sjukhuset.
Yes, independently of what reason it was from the beginning, I'm very pleased and happy that it is this way, because having this smaller volume hospital really challenge new ways of thinking. It provokes the need for new working pathways. And I think that setting a time when the new hospital should be ready, and also knowing that it's going to be from one point of view, volume-wise smaller, really puts pressure on development of this system, because we really need to have patients at the right levels, at the right types of care institutions in order to improve care. We have to realize that at the big university hospital, you are not optimally treated if you do not have a disease problem that really can be addressed there. you are much better taken care of in other places when you have...
It's actually dangerous to stay in a hospital, isn't
It's
it?
extremely dangerous to go to the hospital, and doctors you should avoid.
Yeah.
It's the most
20%.
usual place to die.
And at NKS and Nya Karolinska at the University Hospital, the patients that need that type of care should be there, and we then need to provide service elsewhere to others. Then we need informatics. We need to build knowledge on data, make information available where the patient needs it.
Donnie mentioned earlier that one of the problems is not the new technology, but actually making space for it by throwing out the old ones. Now that you set up a new hospital, what steps did you just skip? And instead, what new ways did you embrace while building this new hospital?
No, I did not follow you.
No.
Okay.
I think I followed you. What is done is we have so much new knowledge now where inpatient procedures can be done as outpatient procedures, both in surgery but also in medicine. And most of the healthcare, actually 80 to 85% of healthcare cost, is guided towards chronic disease. And they are not helped by hospitals in the long run. They have to be taught and have the resources to take care of the chronic disease within the daily life and where they live. So actually we can avoid them to have to go into hospital because of maltreatment of chronic disease. So there's a number of efficiency that can be done within healthcare. And it's not only cheaper, it's actually become much better quality of care.
So healthcare doesn't actually only happen at the hospital, it actually happens in a...
Oh,
yeah.
I mean, previously you've gone to the hospital for care. That's not how things are today, and definitely not how it will be in the future. You need a totally different involvement of the patient, and we shouldn't throw things out. We should instead build on data in a totally different way. Make the patient involved. Then things start to happen. Make data available to patients, their data. Then...
And one reason also why there are less beds in the NKS is that was the whole idea with the network system, that you should have the base, should be the primary system and the e-health services, and this is a very expensive infrastructure in NKS, and that should be used for complicated cases and for learning and so on. And when it's not so complicated anymore, it moves out to normal hospitals. And also, it's maybe not like that there are fewer beds at NKS than at present Karolinska right now, because all these beds are not used, because there are many beds in the same room, and we have single bed rooms at NKS, and that's very important, not to spread diseases. And to be able to have the patient in the center in this big single bed room where all the staff, all the professionals can surround the patient.
If you look at it, that's of course how you would want it as a patient. Yeah.
Well, I'm also a patient. I'm also chairman of one of the diabetes organizations of Sweden, and I also have a few other chronic diseases. So I'm a professional patient in that sense. And what really has happened is that healthcare has lost its knowledge monopoly, which it used to have with the internet coming up. So it's in the same position as the school system were in the 50s, or the church was 100 years ago. And when you've lost the monopoly of knowledge, something happens. And you can no longer try to steer an organization an authoritarian way, because you can actually challenge that. And actually, this is what we're starting to do. And it's not all doctors are happy to see me.
But we've touched on that today a number of times. I mean, who owns the information? And we've had a question to the audience here as well. What's your take on it? I mean, who gets to own the information in the future?
I can start with that. I think we have too many lawyers in Sweden, almost as many as patients in a sense. And they've said that it's absolutely necessary for healthcare to own the records and so on. I believe in the long run that we will end up that the patient owns his own information. And how to be able to go around that, because hospitals do need information when they're working, no doubt, is that we will have information system built up by the patients by themselves. We started to collaborate with patients like me in the US, who wants to also be a part and building up a patient run information system here. And let healthcare have their systems, but we take out what we want to our systems, and then we start to communicate with each other. Then things will happen.
Comments on that?
Well, I agree. I think it should be the patient that owns his own information. But luckily enough, in Sweden, many patients are willing to give their information away. The panel participant that was here before said in the US it's not like that. But in Sweden we are lucky in that sense, and that means that both the patient and other patients benefit from that as well. But we have this patient data law, and all health providers in the Stockholm County are obliged to follow these rules, that if you give your patient data to the health center and you give your data, you can block the medical center to give it away to another hospital or whatever, and that's very important. But you always have this balance between patient integrity and security of the system.
Yeah. Johan, do you have a comment?
I think we focus perhaps a little too much on ownership. I think we should instead look upon what should data help us to achieve. And if we achieve good things for patients, if we give possibility for healthcare to be there and have the data available when it's needed in the care situation, then we will have a mutual trust, and we can build on that mutual trust between patient and care, because data are needed for both in order to be able to do their task, but also to be involved. And if we lose that sense of trust, if patients start to withdraw their data, then it will be a piece of cheese, a Swiss piece of cheese with lots of holes. And then we start to lose some of the biggest advantages of our information system in Sweden. So let's speak about what we want to achieve, and let's agree about that we need to foster the trust that patients have and that care have to in this.
I think that the trust issue comes down to what we spoke about before in the panel as well, when it comes to innovation as such. I remember I was in a conference in a different country together with Mr. Carl Bildt, and he got a question of what could we do to speed up innovation in our country. And he basically said, it comes down to trust, because there needs to be a system in place that everybody knows the ground rules. There's a basic system that you can work with, and then on top of that, you can innovate. Without the trust, there's nothing to work with. It's an interesting aspect.
So if we have the trust, are there any other barriers? If that's like a basis that we need, but are there barriers that we need to remove in order for entrepreneurs to actually be able to thrive in this environment? What would you say?
Yes, there's a number of... The past 20 years has not been sort of signified by increased trust. It's rather been a debate on how corrupt are the doctors of the pharma industry and so on. But I think we passed that now, and I think one of the steps now we have to do is to open up what really hospitals need, what academies need, what business needs, is to meet patients, because you can only develop things if you have patients. And we should open for everybody. The triple helix is now, from now on, a quadruple helix, where patients are the fourth group. And I think we need to make some kind of a committee by the stakeholders here who is on an all-year basis around, can discuss what are the problems, what do we have to do now. That's one of the things. The procurement, we're buying and building a lot. I mean, our investment program from the county councils is 70 billion crowns for the next 10 years. And we're buying a lot of things, and we should buy with an innovation style. That's the second thing we need to do. Third thing we need to do is to alter the reimbursement systems. So today there are a hindrance for new innovation to use them because old ones are cheaper. And we have to change that. So the curiosity that we used to have 20 years ago of using new things comes back and are allowed. So those are the three major things.
Mm-hmm. Thank you.
And you had a comment as well?
Yes, Anders took up this with the reimbursement systems. And one thing with them is that it's not gainful for the clinic or the health center to test new ideas. There are many new ideas, many innovations made in the Stockholm region, but they are not tested because you get the cost when you test, but you don't get the gain from better health or fewer visits. Somebody else gets the gain from that. So the County Commissioner of Finance have launched the idea that we should have an innovation fund in the County Council so that you can apply for money to test this innovation in your clinic or the medical center. And then you can use the money to pay a nurse or somebody to do this testing and evaluate and so. And I think that will be good or it will increase the willingness to test these new ideas in just having them in the drawer.
Thank you, Gabriella. Just very brief, Johan, you had a small, short comment on that, and then it's time.
We are here to talk about electronic health, right? If we go to biological health, we have realized for a long time that we need laboratories. Things where we do experiments. We should never come up with the idea to do that in the patient or on the patient in the bed. But when it comes to electronic experiments and electronic development in health, we still do a lot in the production environment. This we have to stop, and we now have built a laboratory, an informatic innovation laboratory, SLL, Karolinska, KI together. We have to build these kind of innovation environments also in the e-health areas. That will help us to come further.
That's a very good point. Thank you very much.
Thank you. I think we will go to the closing, right? Or should we do the Mentimeter?
Yes, let's
Hans, did you get those different ones? Is that a yes? I think so. I think we actually...
he's waving. Let's look.
Is that a good wave or a bad wave? Of the key factors just mentioned, which one is the most important? Efficiency within healthcare, making place for new technology, make data information available to patients, change regulation with integrity, trust, open up meetings with patients, buy with innovation style, innovation funds for testing. Wow, now there's something to choose between. Let's do one last audience choice here and choose between these. I can't even count them. And have a go at that now and just show us what you think. Which one is the most important? If you had to pick one, please just give us that one.
We have a result. Most important is C. Make data and information available to patients. Thank you so much for giving us your thoughts on this. I think that is this close to what your thoughts are?
All of those are important.
Yes,
all of these,
making things simple is good, but oversimplifying it makes it complicated, and you cannot separate these from each other and say that one is more important than the other. We need the complex mixture.
You are so right. Thank you very much. Thanks to our panel. Thank you. And thanks for participating. And we will meet again tomorrow. We'll further discuss disruptive technology. And we would really encourage you to all mingle in the bar, in the Scandic bar just outside. And we will see you tomorrow at 9 o'clock, starting here in Victoriahallen.
Yep. And I hope you've all had time and opportunity to meet somebody new, hear something new, experience something new, and also think something new today. So thank you very much for today.
Thank you.
Thank you.